Okay, so now I'm going to show you guys a bit of what I actually keep in my bag. This is my cat, Compartment. So obviously I put my checks down. Hi guys, I'm back. This is my follow-up video. I wanted to show you guys what I keep in this is my visit bag, what I bring in and out of patient's house. This is a Hopkins medical supply bag. My job supplied me with this. I'm going to show you some of the things that I keep in. May or may not want to do it this way. That's fine. You don't have to. Your job may tell you otherwise. Some people have different bags that have Ziploc bags in them so you can keep wound care things separately. I don't keep a lot of wound care stuff in my bag because of the fact that A, this one doesn't come with pockets. B, I don't want to carry everything around me, so I just keep it in my car if I really need to. So in this first pocket in the front, usually where I keep my cell phones. That way they're in a fully zippered pocket and I don't have to worry about anything falling inside them while I'm in a visit. I keep this and yeah, I keep this in there. This is hospice eligibility toolbook. So this is something that's specific to hospice, things that you won't find in home care. The PPS, which is your palliative performance scale, it shows the decline in patients. Also how to measure a MAC, which is your mid-arm circumference. So that is going to tell us a lot about if your patient's losing muscle mass, also losing weight. Of general guidelines for different diseases as well, to see if they qualify for hospice. So that's one thing that you're probably going to want to keep in your bag. Next thing is it's a Medline wound care stuff. Kind of helps you along with your assessment of wounds, because there are so many different wounds out there now, all at different stages, and the drainage, all the different things on how to assess it. So if you're new to home care, hospice in general, my particular company does hospice and palliative care. So we do wound care just the same as you would for home health patients. But if you're in general new to home health, this is something good on how to chart wounds effectively so that it can be carried over and given effective treatment. Things like wound odor. Now, do you smell the odor of the wound when you walk into the room? Or is it only in close proximity to the drainage? Things like that to keep in mind when you're charting. And this gives you also treatments, catalog of all the different items you can choose from. Things like calcium alginate with silver, TheraHoney, or hydrogel. They're just regular calcium alginate, Optifoam, a bordered gauze. Bordered gauze I find are very sticky, just as a moving forward. So our patients who have that thin tissue paper kind of skin, more prone to skin tears, probably not going to want to do that. You're probably going to want to do an Optifoam gentle. Just something to keep up in there. But this is why it's good, because if you're not familiar with Medline or any of their products, it's a good thing to, let's say home health is your first job. This is something just to keep in mind. It's also good to have if you work in facilities. That way you can be a little more uppity up on wound care. And I keep a mini drug book in here as well. This one, it's okay. I keep a bigger one in the back because this one doesn't always have all of the medications in it, even though it's new. Doesn't have everything I need to know all the time. I mean, the internet is helpful, but I like paper stuff because I find it more reliable. The main compartment. So in the main compartment, I keep gloves, of course. Gloves, you're gonna want those. My company provides this little thin box. They're 100 per box. A company I worked for before, they provided only the big boxes, so I found myself getting a Ziploc bag and putting my clean gloves in there so I wouldn't have to take like this gigantic box of gloves. I keep this pouch, and I'll show you what's in here in a second. I keep a manual blood pressure cuff. Boop, boop, boop. Of course. Tape. 1 ml syringes, very pertinent in hospice. Usually pharmacy will send out 1 mLs when you order medications, but it's always good to have extras on there in case your patients need them. Some gauze in a plastic bag. So it's separated. And then I keep these. So if you're wondering why I keep doggy poo bags, and why they're heavily unrolled, I can't tell you, because that's just what happens throughout the day. This is for my wound care. So what I do is to double bag, I use these, because if not, I'd be ordering a small waste basket trash bags for my company, but I use these. And you're like, well, sometimes you need a lot more. Yeah, but you'd be surprised at what you can fit in one of these. If you need a little bit bigger, also the bags that they sell for diapers, those also work. They come in a similar style roll up thing to this. I think they're made by like Arm & Hammer or Munchkin or one of those companies. But these ones I just get at like the dollar store or whatever, and it comes with a bunch. And I do my wound care in this, or it's my little trash bag for when I'm there, just so I don't make a mess. I feel like, you know, like I said, just pretend kind of like you're in a facility and treat it as such, so that you're always being respectful of the space around you. This is one thing that I use, doggy bags for wound care, so you can double bag pretty easy and you're not using a huge gigantic trash bag. Other thing to keep in your bag is shoe covers. You go into patient homes, not every patient is going to be okay with you walking around on their carpet with your shoes that go everywhere. So that's what I keep in here. Okay, so what I keep in this bag, this actually has antimicrobial fabric. I don't know if that means a whole heck of a lot. I keep all of my tools. So my blood pressure cuff, I have a wrist one. Not all patients are able to use this. It has to be a certain size wrist. They can be kind of touchy. Not everybody likes them, but I find for my littler, older patients who like to wear a bunch of sweaters, this is way better, and it's a lot easier for them to be compliant with taking blood pressures if it's easier for them to actually take the blood pressure. You may ask, why do we take blood pressures on patients who are transitioning or actively dying? Well, we don't have to, but sometimes the numbers can gauge how long a patient has left, just to keep in mind. And so I keep a cutaneous thermometer as well. Like I said, when somebody is actively dying or transitioning, these can be a little less invasive than lifting up the armpit, sticking it under there, or even an oral one. Pulse ox, of course, it's always a good thing to have. Patients do have parameters sometimes too, even on hospice, of course. We have parameters. And I keep a regular auxiliary / oral thermometer. We don't use it as oral, we only use it as auxiliary because we don't have disposable covers. So I keep all of these in their own separate bag. So I keep them all in their own separate bag. That way they don't have to touch any of my clean stuff. It has to be in a separate zippered compartment. Right, that's what they say. That's what the state says. So let's switch sides. That's the other side. This bag has so many pockets. So in this pocket I keep alcohol wipes. Usually I keep them in the side pocket of my pants. I do use these to clean my stethoscope before patients, clean my glasses, things that need to be cleaned. I try to use these Sandy wipes, which I'll show you in a bit. I also keep our symptom management algorithm, and that's about it for that pocket. That's it, just alcohol wipes, I guess. I keep paper towels, easily reachable, because when I go into patients' houses, I have my bag hanging like this, kind of like over, like a satchel. It's a satchel like Indiana Jones. Anyway, so I keep it like that, so that way I can reach in here without putting my bag down yet, wash my hands real quick, and get started. Well, not real quick, 20 seconds, right? A lot of people might think this is unnecessary, are stethoscope caps. So they look like little shower caps. And then I'm gonna show you on this like nice disposable stethoscope. You want me to listen to you? To listen to you. You just put it over there and it's just another barrier. Like I said, barriers are very important when you're working with patients who are immunocompromised. This does not affect listening to their lung sounds or their heart sounds or their bowels. I have a Littman cardiology, which helps a lot with auscultating. This one, you're probably gonna have a tougher time on those who have diminished lung sounds, especially those you can't prompt to have a deep breath. Stethocap. Bonus. So usually in my front pocket I keep my Sandy wipes, which are just, you know, those stinky smelly wipes that you wipe everything down with, the purple wipes. I call them the purple wipes. So we have individual ones that come in packs of I think 100 that they send us. And another thing to keep on your person if you're a hospice nurse is a MAC, circumference measuring tool. It measures them we measure them by the centimeter. So you're gonna learn how to do mid-arm circumferences, hopefully in training if you've never done them before. I don't know if they use them in home health. I don't know. We use them in hospice for sure to measure, to see if our patients have lost muscle mass and weight, say if we can't get a weight on them. That way we can qualify them. I keep in my side pocket here, hand sanitizer. And I also keep a mouse. I haven't really used it as much for my laptop. But it's there, and oh look at, I had a snack. I don't know why that's in there though. Probably to hide from my little one. Another thing that I use is this. It's called a back clip. So if you saw my last video, you remember that you are not allowed to wear your stethoscope. My hair would normally be down anyway, but you're not allowed to wear your stethoscope like this, walking in and out of facilities, in and out of patient homes, because why do you think? Bacteria, right? Blah. Even though we wipe our stethoscope down so much, it's still, you never know what's gonna happen. I guess you can get flagged by state. Of course they know everything. So it's called a back clip and it hooks onto your waistband here. My suggestion is, because it has a metal clip, you can get these on Amazon. Pretty sturdy industrial metal clip. This will not fall off your pants at all. Depending on the weight of your stethoscope, it can weigh down your pants, but with my Metalitas, they do not do that because it has a really thick waistband. You put this on your waistband. I recommend wearing a full back underwear, like no skimpy underwear, because this might scratch you up a bit. And what you're gonna do with your stethoscope is just kind of loop it like this. Don't loop it too tight, like so. Put it in the back clip, like this. Boom. You have your stethoscope in a cute little carrying case. Try not to bend mine as much as this one, a little bit less bent. And that way, I don't like this thing flapping around, so I often fix it. And I bring it up, where is it? There you go. And that way you can keep it tight right here on you, and you can just remove it after every visit and put it in your bag, or you can just carry it in your bag. I like this just because then I'm not searching around for my bag, and because I did make a good investment in my stethoscope, I don't want it getting roughhoused in here with all the other equipment. It means a lot to me. Yeah, back clip, cool thing. I'll put the link down below if I can find it. It's made handmade leather, or you can find it at backclip.com. That's easier, backclip.com. I've had this for 4 years and it still looks brand new. Cool thing to have. I would say this is a good thing for jobs where you don't have to like have a stethoscope in emergencies, like really rip it out. Like ER, probably not the best place for one of these, because you're gonna have to undo the thing, blah, blah, blah. It's too much commotion. Not that hospice can't get high paced, but it's not like we're like, oh, stat. Do people say that? I don't know. I don't say it in hospice. We need it stat. I hope that helped. So you get an idea of what to keep in your own bag. Now, to keep in your own trunk kit, that's a whole different thing. You're gonna want to keep your Foley catheters. Let's say you're a visit nurse like I am, so you're gonna kind of want a smorgasbord of stuff. Not too much, because you don't want it overtaking your life. So you're gonna want to keep Foley catheters, 14, 16, and an 18 French. More 16 Frenches than not, though. 2 insertion kits and an irrigation kit, because you're going to be dealing with Foley. Another thing is the 1 ml syringes you're going to want to keep, extra gloves, keep chucks, barrier creams, toothets for mouth care. You can keep those in your trunk as well. Like I said, the booties you can also get, precaution gowns, face masks, just in case, because you know it is flu season, and while we are healthcare workers, we do like to protect ourselves from respiratory illnesses, so we can keep taking care of people, because if we're sick, we can't take care of sick people. That's just not right. What else is in your trunk kit? Oh yes, so you're going to want to keep Optifoam, a bordered Optifoam I should say, or a bordered foam, a bordered gauze, a few of them just in case you have to do wound care, clean gauze or sterile gauze, whatever your company wants to provide you with, or both. Some Meta honey sheets, sterile Q-tips, and things like that that you can think of to keep. A lot of companies nowadays will provide a trunk kit. I got mine mailed to my house. My job before this, I had to actually go into the storage room and pick out what I needed. So you can get your alcohol wipes there, your Sani wipes. I would have extra of everything like that. For your own personal supplies, I would keep backup medications that you need. Like I have migraine medications that I have to keep on my person just in case, or Tylenol, chapstick, because you know, in between patients your lips get dry, and maybe some, you know, I don't use hand cream. I do have really, really dry hands, but I just don't like the idea of putting another layer of stuff on my hands throughout the day. And wash off, and then wash. But if you want, go for it. You know, feminine, Products for sure, because you just never know. I take a backup sweater or sweatshirt during the winter because sometimes you go into people's houses that smell like smoke, and it's nothing against smokers, but I just know a lot of other patients who can't deal with that scent, you know, the smell, and it's really disturbing for them. And so I bring a backup sweater just in case, which brings me to another point is maybe bring some spray Lysol. That way you can spray everything down. I wipe my bag down, even though I have my barrier. I wipe everything down in between visits too, including underneath my bag and my strap. Keep all your chargers in your car that you need for not only your work stuff, but your personal items as well. I keep Band-Aids in my car because sometimes my skin does get so dry, it does crack and bleed. And yes, I wear gloves in between patients, but I need something to kind of mandate that, to bandage it, if you will, between patients. Like I said before in my previous video, I want a cooler with snacks, things to kind of hold you over throughout the day, because it can be long days, and if you're running on empty, you're going to be no good to anybody. There's always places to stop and eat, but I find, especially working weekends, being a visit nurse, I often don't have time to stop. Sometimes you're in towns that don't even have like a drive-through. They like voted against drive-throughs. Who does that? I'm not gonna walk into McDonald's to get my fast food. I'm gonna drive through to get my fast food. Just let me get my chicken nugget, okay? Yeah, I work in a lot of towns that they don't have drive-throughs. Why? Please get drive-throughs. Another thing, if you're a visiting nurse or a hospice nurse, I bring quarters. But my job does reimburse for mileage and parking as needed, but sometimes that parking requires quarters. So they're not gonna just, here's a roll of quarters for you, just in case. Probably just bring some quarters of your own. It will make life easier in the long run in case you do end up needing to park somewhere. So that's what's in this bag. A little, you know, tidbit of what you should keep in your trunk kit and what you're gonna need for your journey in hospice. Most of what you're gonna need is here and in here. They're just our tools of the trade. Main things that you're gonna need are your knowledge and your heart. I hope that this helped and gave you an idea of kind of what it's like and what you need to bring. Like I said, don't weigh yourself down with your bag either, because the last thing you need is sciatica. You feel like you're getting weighed down, get a rolly bag. Ask your job if they provide rolly bags. Is that a word, rolly bags? A rolling bag. That's it. I hope you enjoyed the video, and I hope it kind of gave you a little bit of an idea of what you need to be successful as a hospice nurse. And what you mostly need to be successful is here and in here, and then all of the rest should follow. I wish you luck in your journey in hospice. Have a good one, guys. Bye.